to give our talk about our work at Penn. I'm going to start by just giving you a slide about the immune system. So how does the immune system really work? The way we're trying to target it at Penn is by two ways. Targeting the dendritic cells, which are the spies, and these are the spies that scout around the body, go and collect any foreign antigen, chew it up, and then go to the headquarters, which is a lymph node, and present it to the T cells, which are now the soldiers which will go back and combat the tumor in the body. So these are the two components we are trying to focus on to create immunotherapy approaches. So our first protocol was basically we debulk patients at the time of surgery, and we use their tumor to create a personalized vaccine for them. The tumor at surgery should be kept sterile. It should be kept alive. So we store it in a viable manner, which is meaning maintaining it alive, cryopreservation, and then we freeze it. When the patient is ready, after she has undergone her standard of care chemotherapy, she can come to Penn and then enroll in our trial. Here she will receive an apheresis, which is a blood collection. We collect the monocyte portion, we differentiate it into dendritic cells, and then we thaw the tumor cells out. We treat them with some chemicals, which will make them more immunogenic, which will allow the immune system to now recognize them even better. And we mix them with the dendritic cells. And now here we create a vaccine which is personalized for the patient, and we do intranodal injections in the groin for about 5 times every 3 weeks. So it's about 3 months in total. Now, after this vaccination step, some of them can go into another step, which is now adoptive T cell therapy. So what we do here is we perform a collection at the end of that study to now collect those T cells which have been vaccine primed. So instead of losing them, we try to now collect them, store them, and when the patient is ready to go into the second phase, we thaw them out, and then we expand them, and then we reinfuse them in the patient again. And that's to basically maximize the immune response for the patient. So I'm going to just give you a bit of summary. So our findings, we treated 31 patients. We see about 66% clinical benefit, and 11 of those patients went on to adoptive T cell therapy trial, and here we see about 75% clinical benefit. I will elaborate more on the results. I'm going to give you a couple of examples of those patients. For example, here's a patient who had her primary diagnosis in October 2007. She recurred within 14 months, and then even after surgery and chemotherapy. Then she recurred again within 7 months, also progressing on radiotherapy and chemotherapy. And finally, she was debulked again. That's a tertiary debulking performed at Penn. And we put her on our vaccine studies, the first and then the second. And now she has been 45 months disease-free, of which there's 24 months where she didn't even have vaccine to continue on vaccinating her. And to this date, she's still in great condition. So that's one example of our patients. Here I'm just giving you a simple example of how immunotherapy can actually treat some minimal lesions in the body. Like here's pre-vaccination, a node here, and this is post-vaccination. And finally, I just want to say that so immunotherapy is known to have a delayed immune response. And here's an example of a patient who at baseline, all these what you're seeing are tumor lesions. At baseline, she had multiple tumor lesions. At the end of study, she had progressed on most of the lesions. But 6 weeks later, we performed another CT. And here you can see that some of her lesions were actually stabilizing or regressing. And actually, if we go and if you take a picture of those lesions, one of them is showing necrosis inside. So, meaning that initially you can maybe see progression and enlargement of lesions, but that could be due to some tumor infiltrates, and later on these lesions will maybe reduce in size, such as stabilize, such as those lesions. So, to conclude, we've treated 31 patients. 20 had clinical benefit. 3 of those had a partial response, and then 11 of those went into a T cell therapy trial where 7 of them had also clinical benefit, and 1 of them achieved a complete response. Thank you.